Today's episode is brought to you by MRO. MRO is the single source for smarter data. Driving a new era of clinical data intelligence, we connect structure and transform data into actionable insights that enable confident decisions, sharpen operations, accelerate research, and elevate patient care. With 24 years of trusted solutions and partnerships, MRO empowers a stronger healthcare ecosystem built on smarter data so teams can measure, learn, and improve. Learn more at www.mrocorp.com. HIPcast is brought to you by Enterprise Social Record.
Hey, we are all family here today. I'm so excited. Laritha Boone, or affectionately known to us in THIMA as LB, is joining us today. I cannot believe this is the first time you've agreed to come and talk to us. We have tried to get you here for a long time, I think. So thanks for finally gracing us with your presence, Laritha.
Yeah, that THIMA peer pressure. We'll talk about that more.
I know, it's real.
It's real.
Yeah. As we progress through this episode, others will just find out how real it actually is. But we have Laritha Boone with us today. Laritha is former president of the Tennessee Health Information Association, a constant servant to our profession and to our state and to her local. She's also working with Seth to help herd cats and help lead the Tennessee Health Information Management Association. And so we are going to talk with her today about one of her loves. Yes, the THIMA family, she loves us. She loves her real family at home, but this girl loves privacy more than I love data, which is kind of crazy, or more than I love data governance, which is even crazier. But today we're going to find out about Laritha's journey, and we're going to talk about some privacy, and then we'll circle back around to peer pressure.
Yes. The peer pressure is the fun part. That's something that Laritha, I tell you though, Laritha, if somebody got access to our text thread, we would be removed from all volunteer committees.
We certainly would. I think you more so than me.
That's true. I am the bad influence. I will take that and be completely okay with it. And for those that are listening to this will come out on March 23rd. So we are at our annual meeting. So Laritha and I are in the middle of prep as we record this for the annual meeting. And for anybody that has worked in a component association and done all the planning and all that stuff, the fun that we are having. So it's a blast. So we greatly appreciate you being here and taking the time to record with us. Our first question that we always ask, that we have really enjoyed the answers to, is to tell us about your HI journey. How'd you find this profession? How'd you go through school? And tell us a little bit about your career path.
So it wasn't a straight path at all. Kind of stumbled upon it like most people. I wasn't born into HIM, but out of high school, I thought I wanted to be a sports medicine physician. Originally went to college for that, and unfortunately had to leave due to some family things going on. So kind of did a myriad of things before I was eventually able to go back to school as a medical assistant. And so worked in physician offices, like I said, on the back end as a medical assistant, did that for a number of years. And slowly I was at an office, and this person's still a mentor to me today, but she was like, hey, we need somebody to go to the file room and file records and help with referrals, blah, blah. Do you think you can? And I was like, sure. I'm like, I hated going in the file room. Sorry, paper files. I hated it because I'm so OCD about paper. I just about filing. So I was like, oh gosh. So did that, and it was just started a curiosity. And then slowly she kind of was like, okay, well, can you go over here and help with these claims? And I was like, I have no idea what I'm doing. So did that, and I was like, okay, kind of like this. I don't like the touchy-feely clinical side. Sorry, nurses and physicians. technicians that do things on the back end, but I was like, I kind of like this. So slowly got into the administrative side of healthcare. I ended up leaving that group, and I ended up working with a physician who is on the administrative side of healthcare now. And he was kind of like, hey, I think you'd really be good at more like office manager type escalation. So I kind of assisted an office manager, and it was like, okay, I feel like I need to go back to school. And so in my research, I came across the program, sorry, UT, but I'm going to say this, came across an online program at UAB for health information, because when I was looking at health administration specifically, it just didn't seem like it would give me what all I thought it would. So went down the path of looking at UAB and doing it online, because at that time I was married with a young child, and I was like, there's no way I can go sit physically in a classroom and do a degree. So ended up realized I needed all these credit hours beforehand, and I was like, okay, great. So I went and got my associate's degree in business administration from a community college. That was nights and weekends. So I worked full time during the day, and nights and weekends. There were sometimes I had to take like these super 7 o'clock classes, super early classes. And the physician's office kind of worked with me and was like, okay, we can make this work. Did that, got my associate's degree in 2 years, even though they told me it would take me longer because, again, not a straight path. I was taking classes here and there, different campuses around Memphis. I live close to Memphis Metro, so took classes, I think 6 out of the 8 campuses for the community college, because I was like, got to take this, got to take that. So I had to do it when I could. Did that, and during that time, I still stayed in contact with the people at UFB, and I was like, I just don't know. And they were like, well, why don't you try UT in Memphis? They have a program. It's a year in class versus our program would still be 2 years online. And if I did the part-time route, it would take 3. So I was like, okay. So I reached out to UT, and I was like, this is kind of what I'm doing or whatever. They were like, you can start next semester. And I was like, I can start next semester.
no.
And I'm like, okay. So then it was like coming home and having a conversation with my husband and saying, hey, I have to quit my job for a full year. We have a mortgage, car payments, a young child in daycare. Like, are you cool with me quitting, working for you to go to school? So it was like this whole major freak out moment, which I do need to go back. He had just finished school the year prior. So it was like he had finished school and I had started like maybe the semester. There was like a semester gap from when he finished from when I started working on my associates. And then almost, a year and a half later, I come to him and say, I got to quit working. So he was like, I guess, so ended up working out. My daycare was actually a relative who lived down the street on Madison from UT. So she kept my daughter, my cousin kept my daughter until she went to kindergarten, and literally would drive to Memphis. I live about 45 minutes away, drop her off, and then I would go down the street to school. Or if I needed to stay after school, it was just like, it all worked out. So I ended up getting my bachelor's in health informatics and information management from UT. So I did an associate's and a bachelor's within 3 years. Not to say I'm a driven person, it just happened that way. I still, even during breaks, worked for the physician office, filling in wherever I could. And again, physician understood. He went to UT and he knew it was a rigorous program and all of that. So I did that. Out of school, I worked at a federally qualified health center. So the poorest of the poor people, indigent folks here in Memphis. I did that for a year. And then I had an
straight out of HIM school?
Yeah, straight out of HIM school as an HIM manager there. There were 6 clinics, and then while I was there, we absorbed some dental clinics. So they also saw people for primary care, but also a dental side, and we helped bring up an EMR there. I was there for a year, and again, nobody get me for this. there's things in school that you say you don't want to do ever. And one of the things I said in school was, I never want to work in a hospital ever.
Really, mine
Because
was coding.
Yeah.
well,
I want to code.
exactly. There's always
Seth didn't
something.
care where he worked as long as he didn't have to do coding.
Yes.
Exactly. So I have a coding story though too, to tag into this. But yeah, so I was like, I don't want to work in a hospital. And I even said that in my interview with I know y'all know Meg McGill. She ended up being my boss in the hospital side. And I told her in my student interview at UT to get accepted, I was like, I don't want to work in a hospital. I mean, all I knew was the ambulatory side, the clinic side. That's where I lived and was comfortable. So I felt like that would be the best bet. Plus, hospitals are 24/7. So I was like, oh my God, I still have a young child at home. I kind of want to spend time with my family. I don't want to do those things. So the one thing that did pique my interest in school was the the Master Patient Index, or the Enterprise Master Patient Index, which is cataloging of all the patients and making sure patients don't have duplicate records and overlaid records. And that was the one thing I was like, oh, I would love to do that. But in the physician office side, that's on a smaller scale than the hospital, because hospitals see thousands of patients. So it was the one thing that was interesting to me. And that very job became open a year later at Methodist in Memphis. And I was like, I don't want to work in the hospital. But I applied, interviewed again with Meg McGill, and she goes, I interviewed you for school. And I said, yes, ma'am. And we actually don't even live that far away from each other, where I live, here in West Tennessee. And it was like, got the job, did it. And again, I took a job that was on call 24/7. Luckily, I was able to do things remotely from home with merging of the records or researching what is known as overlays into patients' records getting confused. Did that for 5 years and kind of wanted something different. At the time, there were no leadership roles in HIM to advance to. So I ended up going to physician quality and medical staff services for 2 years. During that time, I was working on my MBA online through Western Governors. Did that, learned the whole side of credentialing, quality related to patient care issues, just a myriad of things there related to physicians and those licensed independent practitioners in the healthcare setting. Opportunity came to come back to HIM. Did that as the manager of data integrity and EMPI. Did that for 2 or 3 years. And then we had a small partnership with a major hospital system, kind of oversaw the onboarding of them for a period of time. Did that, and I was like, kind of want to do something else again. And the opportunity to move to privacy came up. Never in a million years, back to things you don't want to do in school. Having to read the Federal Register.
This would be mine,
Yes.
Laritha. This would be
Yes.
mine. This is the thing I do not want to do.
Yes, and Seth probably remembers the assignments where we would have to go in the legal class and go out to the Federal Register and read and write these extensive papers. I was like, oh my God, this is not what I ever wanted.
Now, I kind of like the Federal Register. It's just that I don't look at privacy rules. I know it's weird. But I don't look at the privacy rules. I look at other rules. I love health policy, just not privacy.
Yeah. So it was like,
so
the
Laritha,
one thing.
Yeah, I'm sorry. Go ahead.
Oh no, it's just like I said. It's just the one thing. I was like, oh, I don't want to do that either.
But it's funny because you started in that clinical side, and it was really almost more of a job, and then you found a career in health information. I love that. And also, just so, because Seth brought this up when you said you started as a manager right out of HIM school. Seth is always very careful to tell our students that, listen, you will not start as a manager or a director when you come out of school. You've got to learn how to do all the things. You got to learn the operational components of all those different things. Laritha had been an office manager before, so that is why she was qualified and equipped to be that office manager or that manager after HIM school. She had the experience as well as education at this point, right? Seth, is that why you asked that question?
So I had and I had supervisory roles prior to going to school. So that kind of was like the launching point to move into a management role.
Yeah, and you went to a federally qualified healthcare center, so you're not in the most touted revenue producing space of healthcare in the world, right? It's, for students that are listening to this, those smaller clinics like that, they serve the most at-risk patients that we have, but you can get in there and learn a lot. And that's where you can then take that and jump into a large health system or whatnot from that experience. So that's something to consider for students out there. Because, I do say you're not going to be the vice president of whatever when you first come out of school. But I like the fact that you say that it wasn't a straight path. It wasn't a straight path to HIM. It wasn't a straight path in HIM. It's very common for all of us to have that story. So I appreciate that. You mentioned your privacy stuff, and Shannan, I'm going to take your next question. It's on the outline just because I'm talking. And you're dealing with a bunch of fun stuff in the privacy world. I don't get into the middle of that, but I think there's some fun updates that are going on with and part of the joys of living in the county is some dude on a dirt bike just blows by my road while I'm in the middle of a recording.
I'm surprised a tractor hasn't driven by my house yet. So
Yeah. So for those that don't know, we're all in rural Tennessee.
All three of us.
Tell us about the substance abuse privacy laws that are going on right now. It's kind of a big hot topic in the privacy space, right?
So beginning on February 16th, the Office of Civil Rights, or OCR, all of our acronyms in healthcare, will start enforcing the penalties for violations related to this information. So there's organizations that treat folks for substance use and abuse issues. And again, there's certain privacy protections to those records that are more stringent than what HIPAA outlines. So again, those records are supposed to be kept more confidentially. And so those regulations were put into place. And enforcement, like I said, occurred on February 16th. So my organization does not participate in those programs directly. However, we may receive those records indirectly as a part of a third party or an outside records use or request. So we had to update what's known as our Notice of Privacy Practices, or NPP, to reflect that those records may be released as a part of continuity of care or other reasons. So again, that stricter enforcement of the CFR, 42 CFR Part 2 regulations, and to be aligned with CFR 45 CFR and HIPAA, it just made it where we have to be more aligned to those levels of confidentiality. And the CARES Act is again, back to Shannan and her health policy and regulations things. The CARES Act outlined that we had to make these adjustments going forward. So it was, at first we were told initially, whenever these changes were coming up several months ago, that, we wouldn't have to address it. And again, we were like, we don't have to address it. And then all of a sudden it was a fever pitch to get things done. But we've gotten all those things updated in order to maintain those higher patient privacy protections.
So, Laritha, let me ask you a question. So you talked about updating your NPP, and I understand that, for anybody that is a patient that's engaging with healthcare, you sign this right to privacy. You sign this HIPAA notification that includes your notice of privacy practice, right? It tells you this is what we do. Is updating the notice of privacy practice, does that negate the need for an informed or special consent when some of these records may be present?
No. So we also updated our authorization form to reflect that as well, so the patients know when they're authorizing release of these records that those records would also be covered as well. So we've made that a little bit more robust and clear to the patients that, anything that's a part of our designated record set that is requested by a third party and it falls within those parameters that you've authorized release, that those will be included. So again, we still get patient authorization. The notice of privacy practice is just that. It's a notice. These are the things that can be shared. These are things that will be shared. But then the authorization form itself is that consent from the patient.
Yeah, so the patient still has control over what gets released.
Correct.
In cases where there's a third party request,
Right.
They still have the control over what gets released. It's just that you had to update the NPP and the authorization to kind of cover both sides of that. What are some, I guess, like I can think of from a patient perspective, I appreciate the updates that you all have applied. What are some of your biggest, or maybe the single biggest challenge with this in operations in your organization? Like, and maybe that's not specific to your organization. Maybe it's just across all of healthcare. What's the biggest challenge with complying here? And the reason I ask is just because if now those penalties will apply, everybody's really focused on this. Everybody's really paying attention because that's expensive. What are those fines? And then, first of all, what are those fines possible? And then what's the biggest challenge?
So the penalty range can be anywhere from 145 to thousand to over $2 million. I mean, again, it's dependent. Yeah. So these things are really expensive. I try to tell people, I want to stay out of jail, so you should want to stay out of jail too.
Yeah.
And I still want to be employed at the end of the day because, a facility could be bankrupt. Some of these fines that are levied if there is a breach. But the biggest hurdle, I would say, for us organizationally right now and ensuring compliance of, and this could be apply to any organization right now. If you're outsourcing to a third party vendor, for your release of information, you've got to have a good relationship to know that they are doing what they need to do. And if a release does call for these records, that they're releasing them appropriately to the right party. And if it doesn't, that they're not incidentally releasing those records as a part of the request. So again, I know a lot of health systems don't have in-house release information anymore. That's just the shift in healthcare, is that you're relying on third-party vendors and their workforces to provide that information.
Sounds like a great place, though, for an HIM professional is in the privacy world and understanding the legal aspect of what's going on, what the changes are, but also the operational side of it. How does that actually affect how things are done inside of the hospital? So, again, I tend to like to speak to students that listen to this to say privacy is definitely a place that you should consider when you think about an HI profession and the career path in that, because it's complex, it's challenging. A simple change in a law has a cascading effect to other things. I mean, the fact that the organization you work for is not in substance abuse directly, but you're affected by it, and you have to create a policy and a procedure and a process for your health system to comply, because those penalties, wow, 140 something thousand to $2 million. Ouch, that would hurt. That's the last thing I'd want to do is go CFO and be like, hey, I need a few $1,000,000 here off the razor thin margins that we're running as a nonprofit health system to go pay a penalty. That's never a fun conversation.
No. And also thinking about the privacy, especially related to these substance use records, the further we graduate into or progress into using artificial intelligence or having dynamic, interconnected, integrated things where we're actually going to be interoperable at some point in the future, because I still don't think we're very interoperable now, but thinking about the future of, even the now, but specifically the future of data exchanges that are just kind of like they're more dynamic than they are today. privacy would be a great place for a health information student who understands these rules related to these special consents that are needed. And then how do you govern and maintain the privacy in this dynamic electronic technical world? Is that something that's on the radar for your organization, for you specifically, Laritha?
So yes, so one of the tools that we use related to auditing records actually uses AI and machine learning, and so just understanding that more, and then the governance, like you said, of individuals using data analytics tools and leveraging AI, and AI being integrated into the EMRs more so than they were in the past, or EHRs. It just depends on who you're talking to and what term they use, but that governance of data is more and more involved in, the privacy space.
Well, I'm thankful as a patient that there are HIM professionals out there that
Absolutely.
are doing this and creating those things to protect my information, because I wish there was a button that I can officially accept all terms and conditions on the internet, because I don't read any of it, right? I'm just going to hit the button and take my data. I don't need it. But
that's terrible. Okay.
It is. You want to get into peer pressure? Let's talk peer pressure.
I'm going to get into peer pressure. I want to move into the fun part of this conversation so much. All right. We've had, we've heard Laritha's story. She's gone to work and to school and to work and to school, not a straight path in school, not a straight path in work. And then I know that I think I probably started the peer pressure because I was pressuring Seth, and then Seth and I together pressured Miss Melissa Kohler. I'm not exactly sure how April Insco, I don't know if she just did that on her own. I don't remember pressuring her, but all of us just kept going back to school with graduate degrees, and then we've been pressuring Laritha for a long time, and being Laritha and not having a straight path to anything, she did cave to our peer pressure, but she didn't cave to exactly what we were trying to get her to do. But I am excited to learn. Tell us, Laritha, how have you caved to peer pressure?
So as Shannan said, yes, this started with her, then Seth, and then I think Seth and Melissa tag teamed me for a while about going back to school and getting my doctorate. But I've kind of had some life things happen, and luckily I wasn't in a space to do school during that time. But I'm caving a little bit. So I'll just start with being in privacy. I do work with attorneys a lot. Just prior to this call, I was on a call related to litigation. And sometimes being on those calls, even though I'm the HIM medical record expert, there are times I'm on the call and I'm like, what are they talking about? So I'm over here like feverishly like searching, like, what are they trying to tell me? Or trying to figure out, like, how can I explain this to them so they understand what the record means, because they have an idea of the record and what the record's supposed to look like, but it's not even close. They don't marry. So started to really think about and consider going back to school to get some type of degree related to health law, because again, AI is still relatively in its infancy, I say. I won't say we've mastered it. The governance of this information is still relatively new, trying to figure out where in the organization, and not just my organization, but I would say any space, not even just healthcare, where AI is being used and leveraged. I mean, there are people that are using ChatGPT, for example, on their device, and we don't even know about it. So all those things kind of came together for me, and I was like, okay, Shannan made me onto something that I need a JD. And she just kept going on and going on. She's like, no, don't do the DHA, which is a doctorate in health administration, which is what Seth and Melissa have. And I was like, I don't want to go to school. I don't want to be a lawyer. I don't want to practice. I didn't want to invest all that money to get a JD and not sit for the bar. But again, I didn't want to practice. That's not, as my school colleague and friend that I still keep in touch with, she says, not in her ministry to do certain things. And so being an attorney is not my ministry. I never saw that for myself, even though I was talking about this the other day when I was a kid. my aunt used to say I should go to law school. I don't know why, but I guess because I talked a lot. But anyway, I was like, that's not what I wanted to do. So started researching programs to figure out, okay, if I don't want to go and get a JD, what can I get as far as health law? So I looked at a master's of legal studies, and it kind of didn't really fit exactly what I do. Again, I work in privacy. That's the space that I'm in. Again, and I'm still in my infant stage. I'm not a master of privacy. Let me preface this. I'm still learning because, again, everything changes, and I fly by the seat of my pants every day with an incident. But I started researching and came across 3 programs, um, one in Texas, one in Oklahoma, and one in Florida, that had a specific focus in health law for people that don't have a background in the legal space, that aren't attorneys by trade, but do touch the periphery of health law. So researched those programs and ended up deciding and applying with the threat of my daughter, who is in college right now, of her submitting my application. I'd started my application, it was just sitting there, and she goes, I'm going to log in as you and just pay for it and submit your application. So ended up, I decided on Florida State.
Reagan.
Yeah, Reagan. Decided on Florida State. They have a Juris Masters in health law. They have several tracks, but the track that I chose was cybersecurity, privacy, and risk management. Again, as I mentioned, the call I was on just prior to this, I was working with attorneys with our risk management folks on there as well, who happens to be an attorney. So I was like, this might be the right fit. So going through the coursework and looking at the program overall, there's a specific focus on HIPAA. There's several courses on AI and data governance. So those things kind of marry where I am in privacy right now, and not just myself, but where everyone is in privacy right now. So I will be starting that program May 3rd. Pray for me. Pray for me.
That's awesome.
I'm so excited. You're going to be the smartest person in our room.
That's right.
And you are going to rescue us from ourselves in the future.
So funny you say that. When I was texting Seth this morning about some other stuff related to THIMA, I said, so do you need a bio from me, to make me seem smart? And then I came back and I said, he says no. And I came back and I said, well, I have to make myself sound smart. But it's not that. It's not being the smartest person in the room. It's actually educating yourself and furthering yourself. It's kind of, I'll say this. There's things that you don't see in yourself that other people see. In this group, along with the others that we've mentioned, and I'll say, Dr. Marsha Sharp and Rebecca Reynolds, both my professors at UT, have encouraged me over the years. Beth Bowman encouraged me over the years, like, get my MBA. Like, Beth was like, do this. And she was like, do this program, and I was like, I don't know. And then eventually I did it. So, I mean, that encouragement sometimes comes from other people. But interpersonal growth sometimes is that nudge from the outside. Because, again, you don't see yourself that way sometimes. It's not, I wouldn't say lack of confidence. It's just that, okay, they see this. I know I have this innate ability to learn and grow and stretch myself. It's just finding that right balance and that right time to do it. Yeah. So I appreciate you guys for always pushing me. I mean, Seth's always like, here's this nugget, here's this jewel of information.
He sent me something weird the other day. He's like,
here's some reading.
Here's some reading. And I know that's why it's weird. It's from Apple.
I know, you're an Android person. We'll talk about Android. That. But Laritha,
that was a slight.
That was a perfect way to close this, of the fact that the pathway is not straight. But you have to keep pushing. And there's a network of people out there in the HIM community that you can lean on, that believes in you, that trusts you, and that you can help out in their path. So, Laritha, you're a friend and of THIMA, of me and Shannon. So we appreciate you taking the time and joining us on HIPcast today.
Yes. Thank you, girl.
No, thank y'all.
All right, Shannon, until next time, my friend.
I'll see you next time, buddy.